Okay, so I've been asked to speak a little bit from my perspective as a behaviourist, so I'm going to try and not waffle on too much, but give you a little bit of the background behind how I do things, why I do things, and a couple of case studies that we can think about. So I want to look briefly at some human-animal interactions and different people's perspectives on these, look at my private practice caseload, what I see, and why a multidisciplinary approach to behaviour practice is so important. And then look at how we can use education and collaboration to improve the welfare of the horses that we deal with. So I just put together this little diagram which just kind of reinforces the history of our interactions with horses. So, dating back thousands of years to the present day, where we still have horses used in warfare, and we still have horses used as pleasure horses, sports horses, and a real range of different interactions that we have with them. So these really diverse interactions have quite marked individual variation, and also within us as individuals interacting with horses, we also see that our viewpoints towards different horses can be quite transient. So we often note that we find certain horses that we get along with more than others, that we naturally find them easier to deal with, and that other people might find other horses that we find more difficult, easier to deal with. And so the way we naturally respond to these horses can vary. The way that as a society we interact with horses can be quite variable and has a lot of factors that affect our interactions. So things like cultural norms, what is normal in a society, will affect how we train and treat our animals. And cultural norms are often affected by socio-economic status. So the couple of pictures that I've put here are a very sort of typical picture of a show pony in good, very good condition, but very typical of the kind of show ponies that we see. Whereas this little working donkey in Egypt is very typical of the type of animal that's seen there. So real marked differences in how we interact and we view these animals. And then also education, so the level of education that we have in different countries, but also in different parts of our country. And our past experience of different animals, different places, leads us to either accept our cultural norms or to reject them and challenge them a little bit. And our individual personality also shines through in how we do things. And I think it's really important to think that everybody that we deal with has all these factors going on, and that affects how everybody deals with horses. So, a little bit, very briefly, is to think about the fact that there's been a lot of metaphysical research recently, and that it's quite slow to come into practice, really, that this continuity between humans and animals, and that it's more than just a biological continuity. And I think we need to sort of let that come through a little bit more into our practice. And there's quite a lot of sort of emotional undercurrent about actually what makes us human and what makes animals non-human. And I think the thing that I would like people to think about is that actually it's more of a fact of humans and non-human animals rather than humans and animals, and thinking about the continuity between cognition as well as biological relatedness that we need to contemplate when we're training and looking at behaviour problems. So our human-animal bond, there are quite a different array of human-animal bonds, whether they're functional roles, for example these service horses, performance horses, or just pleasure horses that people enjoy spending time with. We need to think that animals are sometimes used as educators, whether that's in a college setting, whether it's actually that they're bought for children, to learn compassion, to learn responsibility. You have this pet, you must look after it. We have horses that are used as social support, so sometimes they are a support for their human because they may have some other lack of social contact. They're used for health and therapeutic use, so equine assisted therapy is a good example of that. And also, in some cases, that they're used as some form of identity or status marker. There was a really interesting study Cassidy did in 2002, so quite a while ago now, but looked at whether the horses were viewed as objects or subjects, and it depended very much on what was happening to them at that time. So if the horse was being injected, for example, by the vet, it was viewed as a subject, whereas as an object, if they were having a nice interaction with that horse, they were maybe riding it or grooming it or something, then it was very much seen as a subject. So that's the transient nature of how we view our interactions with these horses. So looking briefly at my caseload, I tend to see probably double the number of pleasure horses as I do sports horses. And this, I think, mainly is because the pleasure horse industry is sort of a little bit quicker to come and say, oh, actually, can you come and help me with this? Whereas the sports horse industry, a lot of people are professionals. They try and deal with the problems themselves before calling anybody in. I see a disproportionately large number of racehorses because of where I am geographically and because of my previous experience in the racing industry. But from the perspective of pleasure horses, I tend to see a lot of all-rounders that just do sort of a little bit of jumping, dressage, nothing too highbrow, lots of hacking horses, and a very high number of non-ridden horses, which, when I looked at my data, surprised me. These horses are either young horses, worryingly, that have developed behaviour problems, horses that haven't yet to be backed, aged horses that have had problems for a while, or horses that cannot be ridden because of the behaviour problems and people have just given up ages ago. So I see quite a number of race horses and then a varying number of dressage horses, jumping horses, etc. I tried to collate my caseload in terms of how these horses come to me. And in a second, I've just compared it with canine referrals because it's really interesting. Most of the horses that come to me come via owner contact, that they have had a problem and they get in touch with me, and then I have to send them back and get them to go through the veterinary process. I do get quite a few vet referrals, and then sometimes trainers, especially racehorse trainers, contact me, and then occasionally some bizarre methods of communication that I get some horses referred to me. But when I looked at the comparison with dogs, nearly all of my referrals come from the vet. Very few come from the owner, and it's a massive difference to equine. And I think that's quite an important thing to contemplate, that very few horses are referred via the vet for behaviour problems, and that's something that definitely can be looked at. In terms of the problems that I see on a regular basis, interspecies aggression, mainly human-directed aggression, about 20% of the cases that I see. Very few cases intraspecies aggression or horse-horse aggression, I don't see very many at all. Quite a few fears, phobias, type-related cases. Bit of stereotypic behaviour, generally tends to be more the performance horses. Lots of ridden problems, but by far the most problems I see are groundwork problems. When I looked at these even further, I realised that actually, although I was seeing a huge percentage of groundwork problems, most of them weren't the primary problem that was reported to me. So the problem might be aggression or a fear or a phobia, but actually underlying that problem was the fact that the horses hadn't had an initial proper groundwork training. And so this, when we looked at it, when we broke it down and actually worked on the groundwork, a lot of the problems actually resolved themselves. So I think groundwork is certainly something that we can be looking at in terms of improving training and behaviour and reducing the number of other behaviour problems that are associated with it. So it's a little bit small, that diagram, so sorry. But I think one thing to consider is that a multidisciplinary approach is really beneficial for behavioural workups, and certainly the horse should be going through a full vet workup before it comes to me. Many of the cases that I see are either caused by some current medical issue or through some historic issue that has either been identified and treated or is in the process of being treated. Sometimes these events are related to particular people, certain places, situations, or other stimuli that need investigating. But more often than not, they are a mixture of all of these things, and it makes them potentially quite complex. So in terms of the multidisciplinary team, we need to think that it needs to be comprised of a range of practitioners who are capable, who are qualified, and who some of whom will require licenses to practice, and that veterinary referral process is really important. Okay, so I've got a little case study for you, who is a lovely little Arab cross cob gelding that is 4 years old and was backed and ridden away really successfully, no problems whatsoever, nice private home. And he began to show difficulties with mounting. So it got from basically the owner sort of noticed that he was a bit funny, didn't really want to stand at the mounting block, and then over a period of months it got to the point where he was backing away really quickly and then started rearing when presented at the mounting block. Bridling also became difficult during this time, and the rider had fallen several times while she was attempting to mount him. So we referred him for a full exam, physiotherapist, we checked his tack, we had his teeth checked, and he was declared fully fit, no problems that could be found. When I went to see him, he was fine in the stable, he was fine to groom, groundwork was fine, he was fine to mount from the floor, but he was really difficult to bridle. The minute you took the bridle into the stable, he started becoming anxious, really hard to get the bridle on. The minute he saw the mounting block, he would freeze, wouldn't walk forwards, and certainly wouldn't go near it. And also his ridden behaviour had deteriorated. He was becoming a little bit difficult to ride. So the bridling issue had clearly become an antecedent for him being mounted and ridden. It turned out that the mounting issue, when I looked closely, was actually mainly to do with rider error, that the rider was heavily mounting him. So she was getting on and plonking down in the saddle, and over time this had become really aversive to him. The handler who was helping, it was a mother and daughter, and the mother was holding the horse and randomly either rewarding him or punishing him, but usually at times where she shouldn't have been doing either. And there was a real lack of habituation to the mounting block. It had just been assumed that he would just stand at the mounting block, and no actual training had been undertaken. So there were lots of factors that were affecting it. Also, the horse was young, quite unbalanced. He was quite tense by the time the rider had got on. And he found a lot of the ridden work he was being asked to do quite difficult. He struggled with balance, and he became quite apprehensive, and so this was another factor that made him actually not want to be mounted. So lots of fear and anxiety behaviours, and this, I'm going to move away from the mounting block really quickly, had become a learnt behaviour. So we went through a process of desensitising him, counter-conditioning to all the antecedents and aversive stimuli associated with being ridden. So the whole process from them entering the stable with the tack right through to getting on and riding him. We introduced a cue, verbal cue for stand behaviour, and then we generalised it to all the different scenarios where she would get on. She used to take a little dressage test, we generalised it to that, and to different riders. We spent quite a lot of time, and I spent time with her instructor, working on how she could mount more effectively, be a little bit more gentle when she got on him, and we worked with her mother as well and looked at timing of reward and when to use the markers. And then also we worked with the horse and the instructor, and we did quite a lot of schooling with the horse to make him more balanced, so the whole process was much better for all of them. My second case study is complete contrast to this. It's a racehorse who was presented to me because she was poorly performing. She has subsequently, I just thought I'd put the good news story first, that she won her first race, which was really nice, earlier this year. But she was presented to me for poor performance, and as an aside, she was quite aggressive to people in the yard. So 5-year-old thoroughbred mare, hadn't won a race, was tailed off in quite a few races, and was hugely aggressive to people in the stable. So if the minute you started approaching her, she would lunge at you outside the door. You couldn't get into the stable. She performed quite a lot of stereotypic behaviour. She was fine to ride, going up to the gallop, she was fine on the gallops, but the minute she finished, she would start bucking and becoming quite uncomfortable. She often unseated the riders on the way home. She started self-mutilating a little bit and kicked at the walls constantly. So the yard vet and the trainer referred her to me. She'd had some pelvic musculoskeletal problems, but they were being dealt with. This behavioural history, it turned out that she had been pretty similar since they bought her from the sales, and the behaviour had intensified over the time that they'd had her, which was a few months. We looked at her on the yard and then on the gallops. I noticed what I felt to be quite a few pain-related behaviours and lots of anxiety avoidance behaviours, and that had just developed into full sort of blown aggressive behaviours before anyone had a chance to get near her. So I referred her back to the vet, and she went for gastroscopy. And the outcome was that she had severe gastric ulcers, so it was quite uncomfortable. So she was treated and rested, and during that time we began a behaviour modification regime with her. And most of this behaviour modification was based around making her life more predictable, because it was really unpredictable. She never knew who was coming into her stable, who was riding her, what she was doing, whether she was going out first lot, fourth lot. She didn't know what was happening. So we made her routine more predictable. We gave her one handler, the one that she seemed to be most relaxed with. So he handled her, he rode her most of the time. We put in place a rule where she was removed from her stable at all times when they were doing things in there, because she felt that she was very uncomfortable with people being in her stable. She was rested. They used to turn her out every day when they were doing things in her stable. We did some training in the yard to kind of change the culture from sort of shouting at her because she was, people were frightened of her because she was very, very aggressive, to working with a more sort of positive reinforcement management style in the yard, which benefited actually a lot of the other horses that they were working with. We increased her enrichment in the stable and obviously through turnout. And then we did a desensitisation, counter-conditioning to all the different husbandry procedures that she found really difficult to cope with, and the exercise procedures. And this sort of took quite a long time, but she was rested for quite a while, and everybody in the yard really worked on this process, and it had quite a good outcome. She was much easier to deal with, much less aggressive, much more relaxed generally in her stable, and performed better. The performance increased. So just to kind of round it up really, I think it's important that we think about the idea of multidisciplinary collaboration between vets, behaviourists, owners and all the other paraprofessionals in the industry, so that we can have sort of some form of gold standard for referral of horse behaviour cases, that practitioners in all parts of the industry are qualified, and that they employ current research-based practices. So there's a really clear process for owners, and it's really supportive, and everybody is coming with the same ideas and supporting each other throughout the process. Cross-profession communication and client support will obviously hugely benefit from this idea, and I think for me the important thing is that it will increase the quality of life of all these horses. And there's just a few references there for you to look at. So any questions?